let's talk about things that I do and do not care about in pregnancy. Side note, this stuff, my go-to. Absolutely love it. So there's a lot. And I guess I'll do maybe a multiple part of this series, just so I don't ramble on and on. The first thing that not that I don't care about it, but I'm gonna be doing it, is drinking coffee. You cannot get me to stop drinking coffee. I will have 1 cup a day, usually 1 cup, but it's part of my morning routine that just puts me at ease. It's part of my cozy atmosphere that lets me start the day in a cozy way. Obviously, talk to your doctor about it, but from what I've heard and what from my doctor has told me is try to stay under 200 milligrams is what they have said, and so I'm gonna stick to that. The next thing is pretty obvious, but don't drink any alcohol. I don't do it. I avoid it. I've heard so like 1 glass every now and then is okay, but honestly, I don't see, like, if there's no benefit, I don't see why I would, and I don't mind waiting. The next would be deli meats. So I don't really eat any of it. I never craved, or I was never a huge sandwich fan in the first place. So I have just not eaten any deli meat, and that's just personal preference. I've known a lot of pregnant women who have had sandwiches and deli meats and all that, and they're perfectly fine. There is obviously the risk of listeria that is associated with that, but it's pretty low. I would just, obviously, again, talk to your OB, talk to your doctors about it if you're concerned. But for me personally, Again, I don't crave it, so I'm just not gonna eat it. And the last thing is sushi. So I do still eat sushi, but it's cooked. So California rolls, anything like shrimp tempura, things like that. So I don't eat raw sushi right now, but you best believe that's gonna be my first meal once he's out. I'm so excited for it. But that's about it for like food and drink. There are a lot of other things that I do and don't care about for pregnancy, but maybe I'll talk about those in a later video.